Hello, everyone. I'm Cynthia Demise, the project manager for the new Pride Agenda. Thank you so much for joining us. We are a startup organization, have been in existence not even a year, um, and we are particularly focused on the most underserved members of our transgender, nonconforming, non-binary communities, people of color, people that have less resources. Um, and we essentially are doing two functions, working with many of our colleagues around New York City and New York State. One is an advocacy function, and one is an educational function. In regard to advocacy, we want to pay attention to making sure there's sufficient provision of LGBT services here in New York City and around the state, work with our colleagues at the network and many organizations around the state to be supportive of an increase in those services. We want to make sure that laws that were passed, such as gender, are fully implemented, where we need to have cultural education and mandated training for the state and funded training led by the trans community for many of us in the private sector to be more receptive and understand. We want to make sure that happens. We were pleased the governor made an effort to do that with mandating training for 340,000 state employees in his executive budget. And we want to join both for our community and with allies, straight allies and others, to pay more attention to things that haven't been fully implemented, such as dignity for all students, all the anti-bullying work that needs to really be fully implemented and thought through and supported throughout New York State. So that's an example of some advocacy issues that we're focusing on. Regarding education, we're here to learn from you and to try to provide educational opportunities that benefit you. And so in the context of what's emerged with COVID-19, we immediately pivoted our services, which were going to be community-based services starting in April, to virtual town halls. This is our fourth virtual town hall. We're doing 2 a month. We have first focused on health, wellness, elderly, youth, basically how to enjoy a rich sex life during this time, sex workers, addiction, etc. And I got a smile from one of our panelists already. And in regard to education, we're also going to do a major survey during Pride Month to tens of thousands of LGBTQ New Yorkers to hear what you care about. What are issues that matter to you? Indeed, we're going to do another town hall in a couple weeks that's going to focus on Albany post-COVID. What should we be focusing on for our community? So thank you for joining us. And I'm going to turn it over to my team, starting with
Thank you, CD. My name is Ahmed Mohammed. I'm a community organizer with the new Pride Agenda. We've been hosting these meetings, these virtual town halls for a couple of weeks now. Before we get started with today's star-studded panel and great discussion, I would like to go over some housekeeping rules. So you should see along the bottom of your screen a Q&A portion where if you are interested in asking a question at any time, please insert your question in that function. I'll make sure to source them and we'll funnel them to our host to ask our panelists. Also, you could do that through the chat function as well. It's your preference. I'll make sure to source both of those. Regarding viewing, at the top right-hand portion of your screen, there should be a speaker versus gallery view. We recommend you place it in gallery view just so you can have more of a conversational feel. Again, that's up to your preference. Shortly, I'll be entering my phone number in the chat box so that in case you run into any technical difficulties or logistical problems, I'm one text away and I'll be able to troubleshoot. So without further ado, I'll turn it over to Jason Walker, who will talk about our discussion tonight and introduce our fabulous guests.
Good evening, everyone who's tuned in. Thank you all for being with us this evening for this very important conversation. It is Mental Health Awareness Month, so it's great that we're having this conversation to talk about mental health and wellness as it relates to COVID-19, particularly for LGBTQ New Yorkers. I know that sometimes even for myself, social distancing can feel like social isolation. So it's very important that we have this conversation to show community and make sure that we're supporting each other the best ways possible. So I'm extremely honored and privileged to make sure that we have this conversation tonight and to be with these amazing panelists. I'm going to introduce our fabulous host for this conversation, Kelsey Louie. Kelsey Louie is the Chief Executive Officer of Gay Men Health Crisis, also known as GMHC, the world's first provider of HIV/AIDS care prevention and advocacy. Each year, GMHC serves thousands of people living with and affected by HIV/AIDS throughout the city of New York. I know Kelsey for a few years now doing HIV work in New York City. Kelsey also was the Senior Vice President at Harlem United and is currently on the board of the National Minority AIDS Council, also known as NMAC. So without further ado, I'm gonna pass it over to Kelsey, who will begin the show.
Thank you, Jason, for that wonderful introduction. I like to introduce myself because it gives me another opportunity to say that my name is Kelsey Louie and I am the proud CEO of GMHC. Welcome, everybody. I use he, him, and his pronouns. Thank you to the new Pride Agenda for holding this discussion on this very important topic, mental health. And again, thank you all for joining us. The COVID-19 pandemic and resulting economic downturn have negatively affected many people's mental health and created new barriers for people already suffering from mental illness and substance use disorders. As the pandemic wears on, it is likely that the mental health burden will increase as measures taken to slow the spread of the virus, such as social distancing, business and school closures, and shelter-in-place orders lead to greater isolation and potential financial distress. Additionally, feelings of anxiety or even re-traumatization are increasingly common as people are fearful for themselves or loved ones falling ill and are uncertain of the repercussions of the pandemic. I'm really excited to moderate this discussion with this very distinguished panel about mental health. And so first, before we start, I will ask everyone to introduce themselves. Please include the organization that you represent or what you're doing and your preferred pronouns. James, we'll start with you.
Hello, everyone. My name is James Brace. I am a practicing psychotherapist in private practice. I have 2 offices in New York City and upstate West New York. Happy to be here.
Thanks. And Julian?
Hi, everyone. My name is Julian Cabezas. My pronouns are he, him, and they, them. I'm the Assistant Director of Outreach Programs at Medicare, and I'm also a practicing psychotherapist in New York City. También, I'm a trans Latino.
Great. Kylie?
Hi, everyone. My name is Kylie Madhav, and I'm currently working as the Clinical Support Service Manager at New York's LGBT Center.
And Britt?
Hi, everyone. My name is Britt Reed. I use they, them pronouns, and I'm currently working as the Manager of Economic Empowerment and Client Advocacy Programs at the New York City Anti-Violence Project.
Wonderful. So as you can tell, we have a great panel. So I'll go ahead and start with the questions, and I'll do a little bit of traffic controlling so that we can be orderly, but please feel free to jump in and we can make this as conversational as possible. So the first question, what have you and or your agency seen in terms of mental health or emotional health needs from our community during this time of COVID-19? The impacts of social distancing, staying in place, illness, loss, or grief, and how have you and your agency responded? James, do you want to start?
Sure. Being in private practice, what I've been seeing is sort of what you've talked about already, Kelsey. It's a lot of anxiety, re-traumatization, particularly for an age group that experienced AIDS and HIV. I've seen a lot of resurgence of like paranoia, depression, anxiety, extreme fear, of course. And in a different sector, upstate New York where I'm at, some of the younger generation have never really experienced anything like this. And so I find that there can be certainly some of the same issues, depression, anxiety, but also a bit of recklessness because generally the younger generation is living with family, and upstate they may not be out. So there's extreme isolation, whereas before there was some freedom to explore sexuality. So basically, I've been working with both of those sort of separate issues. And how I address that is just, obviously in my sessions with clients, but I've sort of extended more opportunity for encounters between sessions if people are feeling isolated or having real difficulty with family. And I've seen a lot of improvement in that area, in those areas.
Great, thanks, James. Julian?
So yeah, totally. So at ImmuniCare, a lot of what I've noticed is just a lot of distress from people. A lot of the calls that we're doing right now, we're actually doing a lot of outbound calls just to check up on people. And I think that you kept talking about social isolation, people just feeling very, very isolated right now, and just really responsive in this like really beautiful way when we do reach out, that they feel like cared about and they feel like someone is there. The other thing that I've noticed is also confusion, a lot of confusion around what's actually like real information, what's not, especially with us, a lot of questions around people who are living with HIV and how COVID potentially can impact them. Specifically also within the LGBT and especially within our trans population, a lot of calls, a lot of distress, a lot of worries that are also related to just navigating the distress and trauma of being poor or having these marginalized identities and being able to navigate through things. So a lot of our agency right now is really figuring out what the needs are and then responding to those. So a lot of research, a lot of calls, and doing a lot of that, and also like figuring out how to support our people within that. ImmuniCare, a lot of the people that we work with are a lot of people that also work within our agency. So I think that that's been a beautiful response from our leadership that's been like checking in on us as we do those calls as well.
That's great, and I think those wellness calls are great, and check-in calls are probably helping to reduce isolation. And you also mentioned the critical importance of making sure that we give out good and accurate information.
Yeah, totally.
Thanks. And by the way, I think the leadership of ImmuniCare is amazing. Kylie?
Yeah, so I think that kind of like in tandem with like with what the two previous professionals have said, what we've noticed is definitely an uptick in kind of anxiety levels and experiences of acute isolation. And like, I guess it's not really acute because I mean the kind of like end date for confinement keeps getting pushed out further and further for New York City residents, and so it's probably becoming a bit more like chronic isolation at this point. But kind of like I found that that COVID-19 has served as somewhat of a magnifier for problems that existed among communities before the onset of COVID-19. So for example, people who were kind of most at risk of isolation are experiencing isolation more acutely. In my work, I see some clients kind of for kind of like who are having difficulties in their relationships, and so kind of like being in closer quarters like with their intimate other has definitely magnified some of the kind of just like roots of cause of anxiety in some people. For some people it's been positive actually, but for a great many it's been kind of a cause of distress, right? Because like there's no more protected space that they can go to vent or to to emote in complete privacy. So that's definitely been a challenge that we've seen at the center a lot. And then also too, so in how we've like responded to it is like in the first few weeks of the center's closure, we reached out to our constituents to kind of see where the need lies, and like in terms of like who was most at risk of kind of I guess like falling out of touch with the center, with their respective communities. And so based on the feedback that we got in those early weeks, we've built a new suite of virtual programming for for everyone, but like with an eye towards our most vulnerable community members. And so we're offering all of our old services that we offer. So we're still offering therapy. We're just doing it virtually. We're still offering our groups. We're just doing them virtually, but we've also kind of expanded into more, well now we're offering wellness groups in English and in Spanish. And we've also been very intentional about expanding the services that we offer to people for whom English is not their preferred language of communication, because we kind of like in those like first a few weeks, it came out that people who are not fluent in English might be more at risk of acute isolation, right? Because like they're, again, just at home all the time and might not be able to connect with people who speak their same language in the neighborhood or what have you. So we built out a lot of bilingual services that are happening virtually over the last 2 months. And so those are the main ways that we responded to this significant challenge.
Great, thank you. And I think the work around, the intentional work around making sure that our most vulnerable community members are reached is amazing. And I think one of the things that's happening is this pandemic is highlighting the disparities between groups. And so kudos to you and the center for trying to address that. Before I ask Britt to respond, I just want to repeat the question in case there are some people who just joined us. We're talking about what people, what these mental health professionals have seen in terms of mental health or emotional needs from our community, and how they and their agencies are responding. Britt?
Thank you. So a lot of people have already touched on this, but at AVP, we've also seen a deep concern about folks getting their basic needs met. Many of our clients who are HIV impacted or have other immunocompromised health concerns are really scared to go outside. And that then means that they're having difficulty getting support that they need, such as shelter support or food or medical safety. And so all of these concerns kind of come together: food and shelter related fear, economic concerns, heightened anxiety about just the general state of the world, inability to reach social systems that are intended to support folks, since a lot of those systems have gone remote, inability to access gender affirming care such as hormones, fear for folks' family safety, and the loss of biological or chosen family are also major concerns that have come up. And to echo what a lot of people have said, there's just a surge in deep loneliness and a dire need for social connection that people are expressing to us. And that also kicks up a lot of trauma memories alongside this growing anxiety that comes from isolation. So our clinicians at AVP are reporting a significant uptick in suicidal ideation also as a result of that. And we've also noticed trends of increased substance use and an increased potential for overdose if folks are using alone at their homes. And again, all of these concerns kind of come together and express themselves in complicated grief, heightened anxiety, and depression, as I'm sure most clinicians have noticed and seen. AVP's Client Services Department, our work has been able to adapt relatively seamlessly into remote work, though there are obviously limitations of needing to support clients only through phone or Zoom, and that has many challenges. We also run a 24-hour bilingual hotline for folks in crisis, and we expected to have a huge upsurge in calls from the community, but we've actually been noticing and surprised to notice that the call numbers have gone down. And in part, we think that that's because a lot of folks are sheltering in place with someone who's causing them harm. And I know Kylie touched on this a little bit, but if you're living with someone who's causing you harm, especially in a small New York City apartment, it's really difficult often to get away from that person to make a call to a hotline. And New York City going on pause has meant that many of our community members have had to return to unsafe biological family because they don't have economic security due to losing work. And they're at risk for heightened surveillance, and this includes medical surveillance for our immunocompromised and specifically our TGNZ community members. And that has effectively caused folks to go further underground just to hold on to the safety that they already have. We have an online reporting form option, but that requires folks to respond via email. And obviously emailing in a crisis and crisis counseling via email is a logistically very challenging option. So we expect calls to resurge when shelter in place is lifted, but those are some of the challenges that are coming up at AVP.
Great, thank you, Britt. We have a general question that I think is relevant to insert now. So many people say we will get over the pandemic and that we will be stronger than ever. Do you think that rings true for the communities we serve? And what about for those that live at or outside of the margins? And what are you most anxious about as we come to what could be called the new normal? Would anybody like to respond to that?
I can. I mean, I can just say what I think.
Sure.
I don't know. I don't know all the answers. I feel equally a sense of nervousness and anxiety as well at different times. I felt that way before, before this, and I feel that way now. I can only speak for things that potentially help me in the ways that I move, and so I speak from that perspective. For me, I identify as trans. I don't identify as straight, and I also identify as Latino. And so for me, I come from a lineage of people that have had to deal with things and have had to figure out how to work with the resources that we have available when we do, and to find joy or peace or some kind of light when everything is not going so well, or when you feel like there's not something that's there. And so for me, when I think about this as distressing, I actually think that people who have lived on the margins are in some ways really equipped to work on these kind of things. And when I work in my therapy with people, that's what I redirect people with, is to remind people of our strength and of our resources and of our solution, and how we can bring community and work together, and how we've survived a lot because we've been able to do that. And it might look different now, but we've done this before. And so for me, that's something that's helpful and kind of centering to me. I don't feel that way all the time, I can tell you that. I think that there's moments of anxiety where I'm like, this might never be okay. But then I come back to moments of being like, okay, this is my ground. So that's what I can say.
Thanks, Julian.
And if I could piggyback a bit off what Julian said, like, I think that I tend to agree. I broadly think that there definitely is the opportunity that this is going to be a moment of growth for individuals, for, I mean, entire nations, if not the entire world, right? In terms of like most people, especially the most vulnerable, are kind of in a position where they'll be forced to become more resilient, more risk tolerant in some ways, perhaps as well. And so, like, I think there's the potential for growth in that. I guess that my concern lies, and I consider myself generally an optimist, but I just find myself kind of like going back to what this, pandemic is at its core, right? Like, this pandemic, or at least the kind of like solution to this pandemic as we understand it thus far, is like social isolation, which, for human beings is very social creatures. Like it's forcing us to renegotiate and unlearn, I mean, an entire evolutionary history of human behavior, right? Like, like so much of our interactions as humans are based on the ability to be in proximity to other people. And so, again, I think there's room to learn and to grow and to adapt, but I do find myself kind of just like a worrying about the interim, kind of like before, a vaccine or some sort of cure or just like permanent solution. Like, what does that look like? Like, what does that mean that people, the entire world is going to have to learn to become more tolerant of being alone? And then, so one of my privileges is that I was born in the US, and so I've never experienced what it means to be a foreigner in the United States. But, I do have a sincere concern that this pandemic might, force people into like smaller ways of seeing the world, which are perhaps less tolerant of people who look different, who are from different places, who speak different languages. And so I do find myself worried that this might have long-term consequences for just from multi-ethnic societies like the one that we live in.
Great. Anybody else? Or I can move on to the next question. Okay. So I think it was Kylie who mentioned, I think at first we thought this might be acute isolation and then maybe now chronic. And as mental health providers, we all understand the importance of assessment. So how do we continue ongoing community and client assessment during a time of social distancing and staying in place orders and as things continue to evolve so quickly? Who'd like to start?
I can start.
Thanks,
For me,
James.
it's such an easy question because being in private practice, there's certain limits as to what I can do and what I will do as far as outreach to clients. But that is something that I've changed and looked at during this epidemic, which is having an ear turned towards clients who might miss sessions or come late or are in real stress, have a difficult family situation that's going on, that I'll have talked about increasing sessions or reaching out to them just to check on them to see. And of course, assessment always happens during my sessions with clients, just to assess where they are and if they're having depression and anxiety, typical symptoms.
Great. Britt, do you want to chime in?
Sure, yeah. So obviously we've been using telehealth and phone sessions, and that's been a critical part of AVP's ability to just continue to check in, sort of like James was saying, with community members who we're already engaged with. And in addition, we also have the 24-hour bilingual hotline, which has served as a critical resource for community members in crisis to utilize at any time, which I think has been useful because folks have definitely been utilizing it. And AVP staff then utilizes hotline follow-up calls as an opportunity to check in regarding the needs of new clients, sort of assess for what's happening for folks, maybe if they're calling for the first time in crisis, and to reassess the needs of clients that may be either engaged actively or coming back and engaging after a while because of this crisis and something else coming up. An area of particular hardship for us has been adjusting to work with detained and incarcerated clients. During the pandemic, it's been impossible for us to visit in person, so much of that work has just sort of ground to a halt. And we've really had to make a concerted effort to reassess health and mental health over the phone, which is often really difficult to do when folks are in prison or at Rikers or what have you. And AVP has been conducting a hotline re-engagement campaign to recertify hotline crisis training. And I think that one of the really great things about this situation and the capacity for, crises in general is that human beings do have an immense capacity for generosity. And we've certainly seen that at AVP, where we've had more and more volunteers who want to engage and help, figure out how to support in assessing communities' needs. So that's been really wonderful too.
Great. Kylie or Julian, would you like to respond to this question?
I'm sorry, but should we say the question just one more time?
How do we continue ongoing community and client assessment during a time of social distancing and staying in place orders? And also given the pace of change of how rapidly this is changing for us?
For sure. So I think at this, at the center, like our assessment process, it's happening virtually now. So virtually via video or phone calls. And so I think it looks largely the same as it did before. The one thing that we're assessing for much more specifically now is kind of like if there's any current threat or experience of interpersonal or domestic violence. So we've always assessed for that, but now we have like a separate kind of like questionnaire like set aside like specifically for that topic, because we are, we're all aware of the statistics that that are showing an uptick in IPV and in DV as well. But aside from that, like I would say that our process has largely not changed. Like I'll say that one of the things that's become more difficult is that we're right, because we're now interfacing via video or phone, there's a lot of kind of like nonverbal cues that we're not able to pick up on as readily right now. And so, you know, in terms of body language, is like anything like from the neck down that doesn't show up on camera, essentially. So that's something that we've been aware of from the first week that we went remote, but you know, it remains to be seen kind of like how that might affect the course of treatment, but that is something that we're cognizant of that's changed.
Great, thanks. Julian?
Yeah, sure. So I think kind of similar to what people are saying, one of the things is that I'm really thankful for is that Medicare already had systems in place to do a lot of assessments. I'm sorry, there's like cars going by and stuff. So for people who are just coming onto our plan, we do a new member orientation. So within the first 30 days, we talk to someone, we assess food, housing, security, PCP appointments, different like calls, like just an assessment there. We do like a 6-month assessment for everyone anyways. And then we do assessments whenever we're talking to people. We also have a program specifically for our population who are currently homeless and or people who are unstably housed. So we're doing a calls to all of our members right now to see if we can support in any of those ways. And then also making sure there's, you know, with the evictions, there's longer now, it's until August, letting people know that that's like an option if they need additional information. And then something we put in place really quickly after we moved remote was we began doing assessments for all of our members who were hospitalized. So anyone that's inpatient that we get a report from, we do calls immediately when they're either inpatient or upon discharge to make sure that people have everything in place to help them out. And that's been really effective because specifically for people, like example, I spoke to someone, they had been discharged, they had been given a script, the pharmacy that they were given the script for had closed because it was a mom and pop shop. They were Spanish speaking, so they didn't feel comfortable calling all of these different numbers. The discharge paperwork was in English. And so luckily the two things that we have our team, our community health outreach workers that are doing that. And then we also have a team of an NP and a PA who do all of the calls if we feel like we needs to go higher. And for whatever reason, they can't get in contact with a PCP or a doctor from the hospital. So a lot of it is, and it's been pretty impacted in the since mid-March, we've done over 1,000, like almost 1,000 calls to people. I mean, within that, there's been multiple calls to different people, but that's been really effective as just an additional thing that we're doing.
Great, thanks. And to the panelists, there was a question about whether or not if you can provide some of the numbers that you're referencing to either the hotlines. I saw that Britt did, so thanks. But if you can add that to the chat, and also we'll find additional ways to get this information to you potentially on the New Pride Agenda's website or something, but we'll make sure that we have resources for you. As mental health providers, you know, I think we know that in order to take care of other people, we need to take care of ourselves, right? So what are some of the ways that we can best take care of ourselves, our housemates, and even other folks in the community? Because mental health providers take care of everybody all the time, right? So what can we do? And in particular, are there resources that you might want to highlight, especially that the New Pride Agenda can share on our website? Kylie, do you want to start? Oh, you're muted.
Sorry, I'm thinking about like resources now, so give me 2 seconds. Like I'll go.
Okay, sure. Would anybody like to start?
I'll take it, I suppose. You know, what has been showing up for most of my clients is certainly compassion. What I find is that in these kind of this specific time where people are anxious or depressed, there's not much self-compassion. And so I think first off, it's realizing that the anger and frustration that you're feeling is okay for what's going on. certainly dealing with isolation, which we've all talked about and echoed here, is first and foremost, is to not isolate, is to engage with people that you trust and care about often. What quickly became apparent too is that since people are out of work, is routine, is finding some routines every day, eating at the same time every day, taking a walk, or doing some kind of exercise, maybe even in your living room every day. And for those people who have a routine, is some kind of novelty, some separation from those routines, so that you can get a sense of yourself separate from the things that you're doing.
Great advice, thanks. Britt?
Sure, yeah, I can go next. I think this always depends on the person and their particular needs. Obviously, informed by their unique lived experiences. But something that I'll mention is that this pandemic has really exacerbated and highlighted in my work at ABP that there's just an immense lack of safety for some folks in their own homes. So, for example, people are sheltering in place with a partner causing them harm, or living with a trans or homophobic housemate who's harassing them or committing acts of violence against them. And so to this end, ABP has tried to come out with some specific resources to support folks who are dealing with violence as they shelter in place. So there's a safety tip sheet that I can share with folks that might be useful if you or someone in your life is experiencing any of those things. And it really exemplifies a trauma-informed and harm reduction approach that ABP uses when working with community members. I think something that's also come up that I've mentioned before is just like for folks who are using substances, offering supports so that if folks are using, they're able to do so as safely as possible, including options for needle exchanges during this time and hotlines for folks to talk with someone if they're going to be using alone. Potentially, they don't have to be doing that. And I'll also mention ABP developed a COVID-19 resource guide. So this is a Google sheet with mostly New York City specific resources, but also some national resources. And it has things from food pantries to government agencies and community organizations with up-to-date information on the status of service provision for those different queer affirming resources. So if that's something that folks would like to utilize, I'm happy to share that as well.
Thank you. And just before I ask Julian and Kylie to respond, just a reminder of the question. So what are the ways that we can best take care of ourselves, our housemates, or other folks in our community? And if there are any specific resources that you might want to highlight, please do so.
For sure. I would say the first thing to do is to check in with yourself. I feel like the easiest way to be good to the people around you is to like be good with yourself. Because very often if you're stressed out, it's just it's really hard to be compassionate when you don't have space for yourself. So I would say if you can do that, that's great. I also feel like this is if you didn't already do it, and I feel like it's a hard conversation, but like to have compassion about the fact that you might get on each other's nerves sometimes. Like it's even the best of couples, or the best of families, like it's gonna happen because we're stressed out. I feel like I say that to people to normalize the fact that like it's not all because of us being messed up. This is just like a big thing, so it's bigger than us sometimes. In terms of resources, I was like fighting myself not to go through my email and send that, but I'll send that to everyone after. I would say also specifically for people is like for our members, we have, reach out to your provider to see if there's any linkage. There's a lot more telehealth. Actually, we've been seeing an uptick of people being connected because people have more appointments and different things of that sort. And then I would say too, what I want to highlight in there too is there's also for LGBT communities of color, there's the National Queer and Trans Therapists of Color Network. Within New York, there's Manhattan Alternative, there's the Lighthouse, And then I will also share a bunch of resources for different groups that are being held right now. There's a lot of virtual groups that are being held. And so I'll share all of that if I'm fighting myself not to go do that. I will do it to you, send it out to y'all later. But I would say, yeah, stay in community, and then also feel comfortable not talking to everyone. I feel like people, that's overwhelming. Like people assume because, everyone's at home, I got to answer this call. Like, I know, why aren't you answering? Don't worry about that. Like if you don't have the energy to like talk to someone in that moment, it's okay to take some time for yourself. Like that's a pressure too. I feel like that's the other side of this pressure, that's oversaturation of being connected, which is also something I'm feeling. So I feel like providing space for that and knowing you can take that space, I think is also important.
Great. Kylie?
Yes. And so then kind of like related to what Julian kind of ended with, like I think this is like important for people that like work at home in general, both now and before COVID-19. Like I think being boundaried is really important, right? So, if you're among the people who's been fortunate enough to kind of like hold on to your job and like be able to like do it like remotely, I think it's really important to not let that bleed into your personal life, because right, like now the professional and like personal like spaces have like collapsed into each other, physically speaking. So like I think it's just really important to like set some boundary around your work self and your kind of like outside work self. I mean, and that might mean like switching rooms, right? Like doing something as like simple as like going to a corner of your apartment or house that you don't normally go to, like when you're working. And like being like, as firm with kind of like start times and end times as you might be, you know, prior to COVID-19, and like avoiding the temptation to, be connected to work emails unless it's like required, like for your job, but just trying to like really set good boundaries, I think is really important. I have found kind of like I have found like solace in using this kind of like confinement period, or like reframing this period as like not a period of like, being cut off from my social life, but being able to kind of like actually take up these like personal projects that I've been talking about for years and like never like, not dedicated enough time to. So, so like whatever that looks like for you, like if that's reading, if that's writing, if that's doing like whatever, like I think like really, like I think like we all have something that like we probably said that we don't have time to do. And so, if it's something that can be done at home, this is probably a great time to do it. I think news breaks are really important. So like, like as important as it is to stay connected and up to date, there's times I found that I just need to turn off like MSNBC or Al Jazeera and CNN. It's like, there's a point where it becomes a bit too much at times. And then also like I've found it useful, kind of like staying connected to friends, but also like not, being afraid to go incognito for a while. Like if you don't want to be on the phone, or if you don't want to video chat, like I think that's okay too, because like Zoom fatigue is a real thing. And so like being connected via digital platforms, while it is fantastic that we have that capability, can definitely lead to, like ocular fatigue and just like emotional fatigue as well for some people. And then in terms of resources, the center has actually, like our I&R team, the center is phenomenal, and they put together a really robust list of resources for people, because, people still need to respond to their immigration cases. There's still housing concerns. And so we put together a list of places that kind of like provide the services that our kind of like constituents have historically needed, but that are still functioning virtually. And so I will happily share that. Like it's actually a series of lists, but I can share that as well with folks.
Great, thank you. James?
Yeah, I just wanted to add to what Kylie was saying about boundaries. And what I've been seeing is people who do have jobs are, because of all the powerless and uncertainty that's going on, people are working harder and longer hours to try and take care of that powerlessness that they're having. And so I agree, Kylie, I think these boundaries to separate from work and to pay attention to your personal life and aspects of it that aren't a part of your work life are really, really helpful in retaining a sense of yourself during this time. Yeah.
Thanks. I heard a lot of great ideas. Boundary setting, creating some space between you and work, self-care, compassion, having self-compassion, breaks from media. All these things are great ideas, and I think we all need to remember to be gentle with ourselves. And I think that's a really, really important piece of this puzzle. So thanks. So moving on, are there any gaps in mental health or emotional health services and support remaining? As many of you know, New Pride Agenda is an advocacy organization. So what recommendations do you have for additional government assistance, funding, new legislation, or changes to regulations? Julian, do you want to start?
I'll unmute myself. So I think for one is, I think connected to this thing of work, people who are working might feel like exhausted, like over needed. I mean, not over needed, not, they are needed. And so there's this like level of like, either I'm going to lose my job, or if I have my job, I need to work harder, and or if I have a job and I'm in social services, people need me, so I can't stop. And the thing, and I think that this kind of goes to what people were saying, that like the structural part of this pandemic, that it's not, the issue is not that people can't work 80 hours. People shouldn't work 80 hours, but there's enough resources. This country has enough resources, at least in this country, at least, where people can have more funding to provide services in these social service agencies, so that we can have more people there to provide like expansion of services, where we can have more counselors available, so that we can have more groups, so that we can have people checking in, so that way the people that are in there, we can actually like figure out ways to support the people who are working as well, or that, and also that we can move to a place where we can employ some of these people who aren't working right now, which is another fear. And I think especially with the LGBTQ population, is already a community that everyone has already talked about, that is structurally just usually like has a lot more unstable housing, a lot more instability around employment. And so I feel like this is one of those opportunities where we can provide grants to agencies that are doing the work, or people that want to do the work, so we can expand and have more of the community working with the community right now. And I think that that's something that's definitely necessary. I'm really afraid of, for instance, Medicaid budget cuts. Like, these are not things that people need right now. People do not need to be worried about the fact that they might not have healthcare during a pandemic. That's like terrifying. So that's definitely something that I'm thinking.
Great. Britt, do you have any ideas?
Yeah. I think, just sort of to echo a little bit of what Julian just said, I think this pandemic has really only highlighted and exacerbated the lack of available resources that already existed in New York City. So I think one of the things that comes up the most for the folks that I work with is access to trauma-informed, LGBTQ affirming, affordable, long-term mental health options. At AVP, we have capacity only to do medium and short-term work. And folks who are, most marginalized, even sliding scale options are often too expensive. And it's been really difficult to connect folks to long-term care that is actually accessible. So it would be really great if more options like that existed, mental health wise, that are geared toward folks who maybe aren't as financially secure, especially in the midst of, what will become an even greater financial crisis as this moves along. Folks who aren't insured, because I'm also concerned that people will lose their insurance, and folks who don't speak English as a primary language. That's another big issue that folks deal with. It's hard to find a mental health practitioner that meets all of those different needs for the most vulnerable community members.
Great. James?
I can speak to a lack of support, I think, upstate better than in New York City, just because I spend more time upstate. But what I see, I do work with some minors who identifies gender fluid or non-binary. And I would say services for those students and children and families to understand, to be accepted. There's a lot of isolation around those issues, and certainly parents that don't really understand what kids are going through and don't know how to deal with it. So I would say in smaller rural communities, more education around what gender fluidity means and how to deal with it and support their children would be what I see.
Thanks for reminding us of our upstate neighbors.
Yeah, right.
Kylie?
Yeah, so I think I definitely second kind of like all the like all of the need areas that my colleagues have highlighted here. One thing I just might add is that like I think that during this pandemic and before, it's nothing new, but I think that people who are not kind of like citizens like in the U.S. are uniquely vulnerable at this time and have been uniquely and specifically targeted. Most recently via I think it was the April 22nd presidential proclamation that is being challenged in the Supreme Court, but still was put into effect, like effectively banning, you know, classes of immigrants like that you know, like essentially it's something that affects the lives of hundreds of thousands of people. And I think that, you know, it was very telling that it was, you know, kind of the top of news coverage for all of 2 days, and then it faded away, and yet, you know, it didn't go away, right? And so I think it's really easy to forget that, you know, while there is like a massive kind of like public health crisis happening across the country, there's also massive injustice being done to people who are immigrants to this country or who intend to immigrate to this country. So I think, you know, I would really encourage kind of like agencies to expand the ways that they can show up for immigrants and their families. I think specifically expanding the legal services or access to legal services is like really crucial. This is something that you know, is going to be coming up more and more, especially under this administration. So I'd recommend that first and foremost.
Thanks. We still have a few more minutes left. I have another question for all of our panelists, but Julian has to step off so that he could see a client. So Julian, do you have any closing remarks or things that you want to share, something that maybe you haven't had a chance to say to everybody?
I think it's freezing. I feel like you asked about my last words, right?
Yeah.
Chair?
Yeah.
I just want to appreciate everyone for taking time to be here. I think that just means a lot. I know how much time matters in this time, and the fact that you can give your energy is big. And so the thing that I would leave you with is to just be as kind to yourself as possible in this evening, for the rest of the evening. I feel like if you're here, you already have a plan for the.
Oh, I think he's frozen. Okay. So it sounds like he was going to ask everyone to stay kind to themselves, and that if you're here, you're probably at least thinking about it and maybe one step ahead of most. I think that's what he was going to say. If not, that's what I'm throwing in for him. Okay, so one of my final questions for the panel is, so what actions or steps can we take to reduce risk and promote our overall mental health and well-being? James, do you want to start?
Sure. I mean, I think I mentioned a lot of this before. I think certainly self-care is up on the list because we want our immune systems to be healthy during what's going on right now. And that would include, you know, what you've heard: resting, eating well, having some kind of exercise. Most importantly, I think it's having contact with people that you trust to deal with any isolation that you're having, be it that's virtual, happy hours or with friends. I said as well, routines I think are really important. So would echo what I had said before.
Great. And as an avid runner, I want to echo the thoughts around exercise, any type of exercise. Kylie?
And so I think, I mean, I have allowed myself to daydream a bit more than normal recently. And so like daydreaming can be just like looking at a photo, imagining, a vacation that might not happen in the next few months, but that will hopefully happen like one day. So like I found myself just like allowing myself a bit more, I guess like time to to indulge in fantasy and to indulge in play and maybe even some magical thinking. But I found that has sustained me through these very difficult moments.
That actually sounds luxurious. I think I will do some of that. And Britt.
I agree. That does sound luxurious. I'll echo a lot of what everyone else has said here, and just add to the fact that I think having compassion for yourself and being kind to yourself during this time is really, really important if possible. And just that, queer and trans folks, particularly queer and trans folks of color, have already been surviving and taking care of themselves and ourselves for a really long time. And, despite so many systems actively working against queer folks, I feel so lucky to get to work with this community because we are some of the most resilient people that I've ever had the pleasure to work with. And I think that extra resiliency is super helpful during this time. And there are some really cool and creative ideas that are coming out of this time too. I've seen some amazing mutual aid networks that have developed, some really awesome resource guides, some worker cooperatives that are up and running and thriving. People, in spite of all of the anxiety, are creating some really awesome things. So I would echo too, to just try and, if possible, engage with folks that you trust. Spend time in whatever way possible you can with people that you care about. Staying connected and finding a network if you're feeling isolated, I think is more of an option than folks realize. And I think that that's really, really important during a time when a lot of people are experiencing so much isolation.
Great. I'm not sure about everybody else, but I have been learning a lot. And I actually had a question I want to add, and I promised the panelists that I wouldn't throw them a curveball, but I do have a question that I think it's important to talk about, especially given my work at GMHC. A lot of our work that we do is we work to combat stigma against HIV, stigma against our identities and who we are. And I realized that there is a lot of stigma around mental health and getting support. So, and actually I wonder if in some ways, if many of our services are being done remotely, is that one way to circumvent stigma for now? And I wonder if you might be experiencing that with some of the clients that you serve. But really what I want to ask is what can we do as a community to reduce the stigma around mental health issues? And I'm apologizing in advance because I know stigma is a really tough topic to talk about, but you've all proven to be super smart, so I figured I would try. James, do you want to start?
Sure. I would say, I think the obvious answer is educating to help people to understand that the emotional challenges that we go through are, and the feelings that we have are ways that we learn to cope with it. And that's healthy. Where we've gotten the messages that our feelings are weak and we're supposed to defend against them. Truth is, what makes us stronger are the feelings that we have, and they really, listening to those feelings creates trust within ourselves and enables healthy relationships.
That's great. Thank you. Britt?
Yeah, I agree. I think education is super important. I think we all are socialized, from the minute we're born to believe that we need to be strong, and that, you know, seeking support mental health wise is often frowned upon because it means that you're weak. So I think education is really important, and accessibility. I mean, I mentioned this before, but it's really difficult for folks to access mental health care because often it's not covered under people's insurance plans. So if you're going to have to pay $150 every week out of pocket, that's not an option for a lot of people. So sort of reimagining the system so that more people are able to access mental health support would be, I think, a huge benefit. Because what I've noticed often is once people are engaged in mental health services, there can be a huge breaking down of that wall of like, oh, I thought it was going to be like this, but actually, you know, I'm seeing the many ways in which, you know, this is helping me to learn more about myself and my interactions with others. And that can be a really awesome and transformative experience. But you can't have that if you don't have access to it in the first place. So,
Absolutely. And Kylie?
Sorry. Okay. So I definitely second that. Like, I think that coverage in the United States is definitely a huge issue. Like, I think that we definitely stand out like among developed nations. I mean, in healthcare for all the wrong reasons, but particularly for our unwillingness to kind of like to cover long-term mental health care, especially under most insurance plans, and like not to mention the millions of people who are uninsured or underinsured who don't have access as well. So I think access is a huge thing. And then I think kind of like beyond that, like I hesitate because I see some positive signs now. Like, you know, I hope it's not me just kind of like being like Pollyannish, but, you know, I do see like a larger public conversation around like normalizing mental health and, you know, kind of like reframing it as not something that like afflicts like one particular class of people, but that is something that, you know, that is a topic and something that is an experience of all of us, right? Like it's part of the human condition. And so like I do see a lot of that happening. So I hope that the conversation continues in public arenas and specifically among communities of color, like where I know that there's like, you know, potentially more room for kind of like stigmatization of mental health or seeking help like around mental health, in my personal experience. And so, yeah, I would just hope that those conversations continue and become even more robust as time goes on.
Yes. Yeah, and I think all of you, James, you have something to say?
Yeah, I just wanted to add that a great opportunity right now, particularly because we're in isolation, virtual groups are a less expensive way to deal with mental health. And there's this camaraderie that you can get in groups, such as well as AA groups or addiction groups right now have seen a real uptick in membership.
Yeah. So I think these issues of access and being able to educate others, I think this is why we all should be so grateful to the new Pride agenda for starting this conversation and having this conversation, because that's exactly what we're doing. We're hopefully educating people. We are having conversations that need to happen, and we are hopefully helping people get more access by sharing some of our resources. So thank you. So it's about time to wrap up. I just want to ask all of you for some closing thoughts, either a summary of things you've said, or something that we haven't touched upon. I will say it's been great, and the idea that you are part of the team that is helping to support the mental health of our communities makes me feel so much better. The fact that we have such smart people working in this effort. So for closing remarks, Britt, do you want to start?
sure, I can start. I just wanted to thank you all for hosting this event. I think it's important and wonderful to have these conversations. And it's great that I think maybe even more folks can access this since it's on a Zoom webinar instead of attending in person, which is a a cool way to think about it, I think, too. And I just wanted to reiterate, I know we've talked about this over and over again, but practicing kindness for yourself during this time is really, really important as things move on and as we don't know exactly how long it will take. I encourage folks also to reach out to resources that they can utilize. And I think I posted the phone number for AVP's hotline, but I'll also share some other resources because I think it's really important to stay connected.
Great. Kylie?
Yeah, and so again, I'd like to thank the organizers as well. Thank you to the New Pride Agenda, and thank you to our amazing moderator, Kelsey. And so, yeah, so I think that again, just like prioritizing kind of like self-care, being patient, like with yourself, like no one has all the answers right now, and I think, you know, that's scary, but you know, it's also okay, you know, if you're uncertain about the future, like just like, you know, I mean, to like, I guess embracing the ambiguity of the situation and like not feeling like you have to have all the answers, you know, if that is indeed part of your personality structure normally. And then also, you know, checking in on folks, you know, because this kind of like period of isolation is experienced very differently by different people. And so if there's, you know, anyone like in your lives or personally or professionally who you think might benefit from a check-in, then, you know, maybe do it like a bit more frequently than you might under normal circumstances. And yeah, and that's what I would contribute as closing thoughts.
Thank you. And James?
Yeah, I think I'm not going to say much different than everybody else. Certainly thank New Pride Agenda for this opportunity. Really great to be a part of all the compassion, which I would say is our number one tool right now, is to have self-compassion. If we can trust that the feelings that we're having right now are real and are valuable, it will enable us to connect to people and people that we trust to feel not so isolated, which I think is the most important.
Thank you. Thanks. And just a final thank you from me to the private practitioners in the world who play such an important part in the mental health care of our communities, to AVP for all the work that AVP does in keeping our community safe, and for the center for just being a safe place for so many people, and Medicare for providing so much support to those in need. Thank you for representing these amazing organizations and these amazing professionals. Thank you, James, Britt, Kylie, and Julian. Really, really amazing stuff. And thank you to the New Pride Agenda for allowing me to take part in this very important conversation. As a social worker, I wholeheartedly believe in the importance of mental health care and its connection to physical health care. To Cynthia, Jason, Ahmed, thank you so much for all your work behind the scenes to make this discussion possible. And to all the participants, thank you for being here on an evening, though not sure else where you'd be. And so now I'll turn it over to Jason.
Thanks, Kelsey. And also wanted to extend a lot of appreciation and gratitude for each of you all for offering your remarks, your wisdom, your guidance, and most importantly, the resources, because that's what our community needs right now, is access to the resources to get the support, care, and be in community and network with each other. So I really appreciate you all here today. Also, I want to let our audience know the New Pride Agenda is committed to making sure we have a very diverse and a variety of conversation to make sure we stay engaged with each other and understand how COVID-19 is impacting us. Our next conversation will be centering on how is COVID-19 impacting our legislators up in Albany, right? We want to make sure we stay engaged in the political process as much as possible. We have some amazing members of our community, Deborah Glick and Brad Hoyleman, who will be joining us for a conversation to talk about what's going on up in Albany. We want to make sure we keep our eyes also on key legislation that also impacts our community, right? We want to make sure we have healthy and strong systems on a public policy level to help support our community as well. So really looking forward to continuing the conversations and moving forward and making sure we stay connected and whole as we endure this pandemic.
Thank you, Jason. Thank you so much, panelists and hosts, for a terrific conversation. It's been so fruitful. I've learned so much in this last hour. There have been a lot of resource sharing, and so the new Pride agenda is going to amalgamate all the resources over this weekend and hopefully update our website by Monday. So people can one-stop shop, find all the things that were talked about today. I'll put the website URL in the chat box, but it's www.newprideagenda.org. And again, that'll be updated by this Monday. And I'll turn it off over to CD for closing comments.
Thank you. One of my sort of breakdowns this week was having technology about 8 different times in one day on Tuesday just go default. And so now I'm looking at a screen hoping you could see me because I can't see you. But that continues to sort of be something that tracks with me. I am so grateful. I am so grateful. Thank you. Kelsey, Britt, Julian, James, Kylie. Thank you so much. I too am a social worker. And it just was a wonderful, wonderful, deep discussion. I really, really appreciate it. And I think I'm going to respond as a final comment to the last question Kelsey asked, which is how we reduce stigma. And for someone like myself, that is older and resources and nothing to complain about, so to speak. I'm reminded that just as I have been learning over the past few years from the trans community to learn more and understand and speak up if something is said that is uninformed and not educated, whether that's socially or professionally or even misunderstood in my own mind. I'm reminded about doing that regarding mental health. And thank you for this re-education. And I too will make every effort with myself, my families, my friends, professional associates, and absolutely in the new Pride Agenda advocacy to pay attention to appropriate resources, expansion of knowledge, caring and tolerance for the struggles that we go through. Thank you so much. And I look forward to continuing to work together.
Bye, guys.